Armstrong County, Claude, Texas, Ashley Fulcher, and Kathleen, Dayton. Healthy People 2020 goals are aimed at helping extend the lives of individuals by preventing disabling diseases and deaths due to preventable complications. Goals of this program include education and awareness of efforts in communities, counties, and statewide. SMART, specific, measurable, attainable, reasonable, and timely goals have been set forth throughout this program.
Healthy People 2020 is aimed at helping extend the lives of individuals by preventing disabling diseases and death due to preventable complications. Goals of this program include education and awareness efforts in communities, counties, and statewide. SMART goals, which stands for specific, measurable, attainable, reasonable, and timely, have been set forth throughout this program.
Some specific goals include gaining the affiliation and support of government entities in the education of specific populations. Further goals include eliminating inequalities in health promotion in order to achieve an overall reduction in preventable early deaths and disability. Finally, health promotion across the lifespan, not specifically within one age group or one ethnicity, gender, or culture, is a key component of Healthy People 2020.
For this project, we have been assigned Armstrong County in Claude, Texas. Armstrong County is approximately 913.63 square miles, with a third of that being occupied by Pelodero Canyon. Armstrong County is closely bordered by Randall, Potter, and Carson counties. There are no physicians, hospitals, or health clinics in Armstrong County. There are 6 registered nurses that reside in Armstrong County. Armstrong County has an estimated population of 1,949 people with an average age of just under 45 years old, compared with the average median age in Texas of 33 years old.
The majority of this population is married, Caucasian, and live in owned family housing units. Caucasians account for 96.2% of the population, compared with 80.3% Caucasian population in the state of Texas. There were 11.1 births per 1,000 people in 2013 and 12.0 deaths in 1,000 people in 2013. Of the adult population that is employed, 21.6% work in education, health services, and social service. This is closely followed by agriculture, forestry, fishing, and hunting services with 12.6%. Finally, retail and trade professions account for 6.2% of the working adult population.
The median household income in Armstrong County is $38,194. In the state of Texas on a whole, the average income is $51,563. Armstrong County has a slightly lower poverty rate than that of Texas, 14% compared to 17.4%. Income ranking below the poverty line is 10.6% and 50% below the poverty line income-based statistics of 2.8%.
Armstrong County has one school district comprised of an elementary school, grades pre-kindergarten through 5th grade, and one high school, 6th grade through 12th grade. There are 173 students attending elementary school. Of those students, 64 are eligible for free lunch, and 29 are eligible for reduced price lunch. The average cost of breakfast is $1, and lunch is $2.50.
There are no sports or extracurricular activities outside of recess in this school. There is, however, a playground with a basketball court, tennis court, volleyball court, and baseball field adjacent to the school.
The high school is attended by 193 students, 43 of whom are eligible for free lunch and 20 who are eligible for reduced price lunch.
There are both basketball and football teams at the high school, but that is about it as far as extracurricular activities go. According to census data, 27.2% of high school students consider themselves to be active in sports or outside of school.
Health statistics in Claude County closely resemble those in the state of Texas, with an adult diabetes prevalence of 10.5%, just slightly higher than Texas, and an adult obesity prevalence of 28.7%, slightly less than that of Texas at 35%.
Factors contributing to the prevalence of adult obesity in Armstrong County are possibly due to the single grocery store in town and the single full-service restaurant. Claude has recently acquired 2 fast food restaurants, a Subway and a Dairy Queen. However, fast food is one of the leading contributors to obesity.
Chronic diseases might be prevalent in Armstrong County, but according to the census data, only a few mortalities have occurred related to heart disease, cardiovascular disease, diabetes, and cancer. When the census was last updated, 6 deaths were contributed to heart disease, 186.7 in the state of Texas, 1 stroke compared to 167.6 in the state of Texas, 4 from chronic respiratory disease, 43.4 in the state of Texas, and 2 deaths from Alzheimer's complications compared to 23.1 in the state of Texas.
Further health statistics include 1 reported case of gonorrhea, 5 cases of chlamydia, and 1 reported case of varicella.
Armstrong County is low crime, with the majority of arrests resulting from theft or burglary. There are 54 individuals institutionalized in Claude for various disabilities and mental disorders. There are 108 individuals with sensory disabilities, 198 with physical disabilities, and 100 with mental disabilities.
There have been 7 potentially hazardous tank or chemical spills since 2008. There have also been 2 tornadoes and 2 fires that have required a state of emergency to be issued. The majority of the homes in Claude were built before 1938. There are a number of mobile homes, condos, and apartment complexes. Specifically, there are 276 mortgaged homes, 343 owned homes or condos, and 132 renter-occupied facilities. Most families own at least 1 vehicle, and that is used as the main source of transportation. However, the school systems do offer a bus service to and from school.
This community assessment serves as a stepping stone to identifying the strengths and weaknesses within a community in order to specifically focus teaching and other interventions on that county. According to the research we have conducted, we have concluded 4 areas of weakness within the community: diabetes in the adult population, lack of physical extracurricular activities for children in school, sexual education, and the need for disaster education in case the need arises again.
Focus categories not met relating to Healthy People 2020 are education, reducing disabilities, and reducing mortalities related to preventable diseases.
As the community health nurse, it is important to educate the population in ways to prevent diseases or minimize the damage caused by chronic conditions. In the diabetic population, we would educate on diet, exercise, and the potential need for oral anti-diabetics to increase the life expectancy and limit the disabling effects long-term diabetes has on the human body.
Physical activities in the adult community could be aided by the addition of a bike trail, a community physical fitness center, or a public swimming area. In addition, the grocery store should be equipped to meet the needs of health-conscious individuals with fresh fruits and vegetables and lean meats.
The second area we would address would be physical fitness for children. Obesity rates in the younger populations are steadily increasing along with the prevalence of juvenile diabetes.
In Armstrong County, we would implement educational programs in the elementary school to teach the younger generation to eat healthy, exercise, and limit sedentary activities such as watching TV or playing video games.
As part of the primary prevention techniques, we could hold a county health fair at the school to encourage the children and parents to educate themselves on healthy food options and inexpensive food preparations that would benefit the health of everyone in the community. As part of the secondary prevention, children could be screened for early onset diabetes, weighed, and have their BMI measured in order to guide their health care. The third area we would address is sex education. Small communities without a lot of activities tend to have increased pregnancy and sexually transmitted diseases. Education at elementary and high school levels should be implemented.
The final area of weakness in Armstrong County that we would address is the need for emergency and fire safety education. Armstrong County is directly in Tornado Alley, and it is important for members of the community to be able to take shelter in appropriate places during a tornado or have an escape route during a fire.
A community health fair would be an excellent venue to educate the entire population of Claude in emergency preparedness. As the community health nurse, we would have each member of the community formulate an escape route from their home, a meeting spot with their family members, and we would assist in preparing an emergency kit. In the emergency kit, there should be first aid supplies, water, non-perishable food items high in protein, flashlights and batteries, and blankets. As far as fire safety, the most helpful education that we could provide would be to have an efficient escape route, ensure everyone knows how to dial 911 and knows how to use a fire extinguisher.
Claude does have a volunteer fire department, so it would be important to incorporate their knowledge into the health fair. Armstrong County is a close-knit community, and with a little education and direction, they could easily achieve the goals of Healthy People 2020 and limiting disparities and living long, healthy lives.